Caring for the Vulnerable, Session 3B. We talked about some of the factors that created vulnerability. We talked about the physical factors last week. Let's look at the social factors. We have loss of jobs, and with this economic situation the country's in, many people are falling into these particular areas. Loss of job, loss of home, health insurance. There's poverty level, economic status has changed. Their stress level has increased. They may have inadequate nutrition. Their failing health is there. Their hygiene status. And there's a possibility, there's a stigma of having loss of all these things. Additional physical factors, we talked about the HIV last time, but there's also hepatitis B and hepatitis C. B is not too crucial, however, nonetheless, it will put you at risk or vulnerable for other things. But hepatitis C today still has no vaccine, has no cure, therefore your risk of being vulnerable to other illnesses is there. Tuberculosis, head lice, as well as substance abuse and drugs. If one's an African American status, ethnic group, there are 20% of the 1.7 million people in Broward County are African American. So you think about that. And about 500,000 of the African Americans are at poverty level. There's 88,000 below poverty level, and about 20% African Americans are below poverty level. So when you think about public policy in Broward County, the Sun-Sentinel reported that in January 21st of 2011 that the health department will stop offering primary medical care, mental health care, and case counseling to the uninsured HIV and AIDS patients, and that's going to begin in March of 2011. So what's going to happen to that population now? So public policy cost. What is the cost of homeless when you think about it? What is the cost of public policy for prevention? What is the cost of the homeless? They state that there's about $1,600 to prevent homelessness. That's what it takes. However, it takes $12,000 to assist a family of 3 out of homelessness. So doesn't it make sense to prevent it? In addition, public policy, they want to passage of Social Security. When they talked about segregation when Social Security was first passed, it only was not for was for those people that paid into it as we do today. However, if you were a domestic when it first passed, you were not able to contribute. Therefore, the propensity of your being poor or without any kind of health care or any kind of service when you're 85 or older was very, very small. So there's been some studies about the Health Believe model that is perceived that vulnerability is at risk in perceived vulnerability in high-risk populations. So the risky behavior shapes one's perception. That is, if high risk equals HIV contact. Usually that's the case, but I don't say all the time, but it can take place. So what solutions? Education is the key. Education is certainly powerful. So if you're educated on how to make a living, if you're educated on how to have good health care, if you're educated on the different communicable diseases that are there and how to treat them, you'll be much better off in the long run. So education is definitely the key. So when you look at these kind of things, you realize what model will the nurses use? Well, let's look at some concepts that are building blocks for vulnerability. So there's poverty, as we thought, homelessness, discrimination, prejudice, homosexuals, and transgenders are the ones that we've talked about so far. So then if those are the concepts, what are the healthcare theories that we can use to address those particular concepts? And you really can use quite a few. Orem is one, the self-care deficit theory. The Roy adaptation model that talks about the physical and the social environment. Most definitely can look at that. King's theory, where it talks about individuals' actions within the group, therefore influencing the behavior within the group to change it. So if you can do that for one, such as someone with HIV or TB, if you can change that behavior, they can then influence the next one. Leininger's theory of cultural. You can understand the different cultures, cultures, then you can be able to aid that particular culture in such a way that they can understand and accept. There's Watson's theory on human caring. That goes without saying. Letting someone know that they care, that someone cares, definitely and boosts their self-esteem. Then there's Rogers' theory of Unitarian, human beings, human processes within the human being, and then Newman's healthcare systems model, talks about the meta paradigm, and then of course the health belief model. These are all models that can be used in nursing as we're taking care of the vulnerable.